Good morning, everyone. It is Thursday, March 10th. Welcome into the Morning Medical Update. We are taking a live look this morning out at Mount Kilimanjaro in Africa. Let's take a peek here. There it is, behind the clouds. Out in Africa this morning, it is World Kidney Day here. Back here in the United States, that is. They're a little ahead of us. We're going to tell you what one group of hikers is doing to raise awareness and what makes their trek up this mountain so incredibly special. Dr. Kumer, transplant surgeon here at the health system and physician VP of Perioperative and Procedural Services. Oh my gosh, you've got the longest title. Okay, he is here to talk with us about the changes in kidney transplants, answer your questions, the role robots play in some of those procedures, and nephrologist Dr. Jeff Klein. He is back with us today to explore the best options if you need a transplant or if you yourself want to share your spare. All right, from Tanzania, Africa to the metro here this morning, a live look out at our KC Scout Cam. You can see traffic. Everyone's kind of staying home today, it looks like. Okay, roads are covered in snow. I was coming in today. If you go slow, it's not too bad, but they are covered. We're still under that winter storm warning, and we're expected to get up to 7 inches of snow. I don't know if that's happening, but if you do have an appointment today at the health system, but you don't want to risk it, we totally get it. You can contact your doctor this morning. You can reschedule or set up a telehealth visit. All right, so wherever you're heading today, just be careful, slow down, leave early. And headlines this morning. The first man to receive a pig heart transplant has died. David Bennett received the transplant at the University of Maryland. This was back in January. Here recently, though, his health began to deteriorate. He was not eligible for a human heart transplant because he had not been compliant with earlier medical recommendations. We're going to ask our docs here today on the panel what all that really means. We'll talk about that here in just a bit, but new research shows it pays in added years to your life to get those daily steps in. Scientists at the University of Massachusetts say those under 60 need to complete 8,000 to 10,000 steps a day. That's not always easy, while those over 60 need about 6,000 to 8,000 steps a day. They say walking helps your muscles, heart, and brain. All over good stuff. Okay, and those warmer temperatures may not be good for everyone. A recent study published in JAMA found that those heat waves increase the number of ER visits for mental health reasons, including substance abuse, anxiety, and stress-related disorders. Get your questions sent in to us today on YouTube, Facebook, and the Medical News Network, and on Twitter. You can find links to those right there on your screen. All right, now let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. We've got our COVID count this morning. Hopefully some more continued good news.
Yeah, our numbers are going down. Hopefully we can begin to discuss COVID less and less. Certainly today we have 15 active infections with 2 in the ICU, 1 on the ventilator. 71 in that recovery period, so a total of 86. But again, I think that important point is that the 15 active infections as opposed to where we were a few weeks ago. So numbers of active infections have come down very nicely. Hopefully they will continue to come down. We know cases all around our community and in the nation are continuing to decrease as well.
Getting closer and closer to zero. All right. Thanks, Dr. Hawk. We'll be back in a bit. Okay, how far would you go to save a life? One woman knows, and she is ready to shout it from the mountaintop. She gave the gift of life, and her message is the gift that keeps on giving.
Try to start early, because I'm going for kind of a long time. I pack a lunch, I pack snacks for the whole day, and I'm usually out for 6 to 8 hours.
This has been the weekend routine for 40-year-old Stephanie Meyer for the past 6 months. Why, you ask?
Life is short and it's fleeting, and you should take that opportunity to do whatever you want to do, as crazy as it might sound. You can do fun things and meet new people and climb mountains with strangers.
For real. An actual mountain with strangers. Stephanie will summit Mount Kilimanjaro March 10th, World Kidney Day. A special moment, not because she received one, but because she gave one to a stranger.
I saw on Facebook that a girl I had gone to high school with 20 years ago, that her husband, who I didn't know, had polycystic kidney disease and was added to the transplant list.
Stephanie was tested and was a match.
And the timing of it was super interesting to me. So I lost my father when I was 4, and every year, kind of on the anniversary of his passing, I've tried to do something to kind of honor his memory.
And she did just that.
Take care of my kidney.
By sharing the ultimate gift with Dan Harmon in December 2018.
We'll see you on the other side. All right.
She donated her kidney.
How's it going?
It's going pretty good.
And saved his life. And now she's on to the next big thing, climbing one of the highest mountains in the world.
Just a little mountain, yeah, over in Africa, no big deal.
More than 19,000 feet with 21 other kidney donors, each with their one kidney to raise awareness through the group Kidney Donor Athletes. But training and prep to climb more than 3.5 miles straight up
Listen to a lot of podcasts, call my mom, check in on her.
starts over here on the flatlands of Kansas, up with the sun.
People have been very sweet and volunteered to come and walk a couple hours, not 8, but it's helpful to kind of kill the time.
Your husband thinks you're crazy.
Yes, correct. I think a few people do, yeah.
Call her crazy, but that feeling when she reaches the top will be worth it all.
I'm a total crier, so I think that will happen without question, but I think it's just going to be such an just overwhelming gratitude. I think a lot about what kidney patients go through. This feels like a pretty minor, even though it's a pretty tall mountain, like a pretty minor thing to just show, like we understand and so appreciate everything that you go through in your daily lives.
And on that day, in that big moment, she'll be thinking of her dad, of course, and Dan, and so many others, ready to live life and climb their own mountain.
Now I get 3 years in, I get to see him going out and traveling and eating whatever he wants. It's just been wonderful.
I absolutely love the smile on Dan's face right there. And that is Stephanie as she summited on World Kidney Day over in Africa on Mount Kilimanjaro. That was the big moment. Look at that, right at sunrise they did that. So quite a moment for those folks. Lots of tears, as Stephanie said, and lots of celebration. All of them with one, there's 22 people, so that's 22 kidneys right there on your screen. And I know Stephanie was both of your patients. What's it like just to see people? I always say, I told Stephanie, I said, giving your kidney, I think, is enough. I don't think you have to climb the mountain too. But these are just these kind of people, right?
Yeah, absolutely. They're really the heroes, right?
Right.
I mean, they're saving somebody's life, it's just an honor for both Dr. Klein and myself to shepherd folks through this process. And it's my honor that I am privileged to operate on them, and they trust me with their life. This is, I always tell them, this operation, everybody getting an operation here at KU is trying to get better. These folks are not going to get better. We're hoping to keep them the same. And, one of the tenets of medicine is first do no harm, but we're sort of doing harm. But we're doing that for someone to help somebody else with life.
That's one of the first lessons I remember you sharing with me. As you said, you're right, there's a tremendous amount of responsibility when you bring a completely healthy person in, and you're cutting them open, and you want to make sure that they stay safe. Jeff, what's it like, or Dr. Klein, what's it like to see your patient up on that mountain after being down here in Kansas in our hospital?
Yeah, there is a certain anxiety of seeing someone that we've taken through this medical process and surgical process. But
like, what are you doing?
They're doing so well and
Right.
feel so well. I think that is a testament to the fact that someone can not just live a normal life after donation, but they can excel. And I think this whole group of athletes post-donation shows that. They've taken a chance by donating a kidney, and they've helped so many other people. It's great to see them spread awareness in this way.
Okay, so Stephanie and I have been texting throughout the week as she's climbing up. She actually just texted me just now, and she said she was trying to get service. She's like, I've been trying all day to try to get service to call in. We were going to try to go live from Africa. We've never done that before. So that would have been very, very cool. But I just want everyone to know she's doing well. She's texting us this morning, and we're just so glad to hear from her and see her face and know that she made it to the top. And now they're making their way down. So just want to ask you, Dr. Klein, I'll just start with you, but somebody like Stephanie, what do they need to know? They see a Facebook post and they say, wow, I would really like to do that. That sounds like something I could do. What do they need to know? How do they even start that process? Is it a phone call? Do they have to be registered?
Yeah, every transplant center has a slightly different process, but the first thing to do is to contact the transplant center where they intend to donate. They normally, at our center, can call, and that way they can start the process of doing an interview where there's an intake to make sure there are no direct exclusions to donation. From there, as the process unfolds with medical evaluation and visits, they can proceed to donation. So it is a process, but the key first is an interest, a volition, and from there we pick up the rest as a transplant center.
any cost to the donor?
There should not be in general. So the idea is that the donation process is essentially cost neutral. There are, of course, some other parts of this that are not financial that we can't calculate, but the idea is that we make the process of donation as feasible as possible for someone interested in donation.
That they are giving enough and they don't need to give the financial part of it as well. What does World Kidney Day mean to both of you? We have a day dedicated to it. We've got people up on big mountains all over the world doing cool things, but just to have a day dedicated to honoring recipients and donors, what does it mean? Dr. Kumer?
Yeah, I mean, I think it's pretty incredible. I think bringing awareness to this issue and education to everyone out there is really important. You know, we don't have enough donors out there, deceased donors or living donors, for the amount of people we have on the wait list. People are dying on the wait list, and just want a chance to live and see their children, you know, graduate or get married or other milestones in life, and they're just clinging to life. And so it's really important that we get education out there for folks. It's a life-saving operation. Yes, particularly for kidneys, yes, there's dialysis, but dialysis speeds the process to the grave for patients. Mm-hmm. It really is tough on the body. And so the quicker we can get somebody transplanted and less time they spend in dialysis, it just improves the quality of life and keeps them around longer.
So, Dr. Klein, that was my question. Just what are other options? If you're on the list, what is life like waiting on that list for these folks? Is it just dialysis? Is there other options and treatment?
Right. So on the wait list, there are two ways to end up there. One is to have a lower kidney function but not require dialysis and go through the checklist of wait list, so you can actually accrue time without being on dialysis. There's a subset like that. We also have a lot of folks that are on dialysis. That can be a really difficult period in people's lives. It involves frequent medical touches. Sometimes people are on dialysis either every day or several times a week, and it takes a toll on their bodies over time, and it's a lot of work for the support system to handle.
So tell us the main difference between a deceased kidney and the challenge of finding your own living kidney. I mean, both pose challenges.
Sure. Most folks that encounter living donation find donors through friends and family. Social media has become a more recent avenue, but still the majority of donors are found through friends and family. For those that don't have that opportunity, deceased donation is the conventional method. That's still where the majority of people find their donors.
But people who receive deceased organs have less. It's just the integrity of the organ is less, correct?
Yeah.
In some cases, but not all?
Yeah, there's some variability there. It's hard to say. You know, the conventional things that we usually say about living donation is that a living donor kidney will survive about 3 to 5 years longer for the recipient. And that's sort of a rule of thumb. It's not always the case, but it's most of the time the case. So, and you know, it changes the whole dynamic, right? So you think about living donation. You don't spend a lot of time waiting on the wait list. Mm-hmm. You have an elective operation. You're not called at 3 in the morning to come into the hospital, et cetera. It's more convenient, and you can do it a little bit quicker than deceased donation wait times.
What is that like? Life of a transplant surgeon? What do you get those calls in the middle of the night when deceased kidneys come in and you're called to duty? Yeah.
Well, it's a long process. I think, you know, a lot of my friends kind of kid me, and I get a call and we might be out to dinner with them, and they say, "Oh, you have to leave now." I go, no, it's a long process.
Right.
Usually get calls at random times when there's your patient on the deceased donor list comes up for the match,
okay.
And then you assess the organ for its integrity and also the recipient, and there's usually an interplay between the medicine doctors and the surgical doctors, and then you decide, yeah, this is a good match, or no, it's not, or we'll go down the list. But then the whole process sort of, what happens behind the curtain of bringing somebody into the hospital, getting them admitted, getting some tests done, and then actually getting to the OR. That might take 24 to 48 hours. And sometimes it's quick, but most of the time it takes a long period of time.
But then the day of a living kidney donor, I've been inside those
mm-hmm.
pre-op areas, and it's kind of joyous in so many ways. You've
It
got
is.
the family of both, and there's lots of high fives and hugs and kisses, and you've got Dr. Schmidt, Dr. Kumer sitting by their side, and it's kind of a neat time.
It is. It is. They're excited. They're scared. They're nervous, right? Most of our living donors, they're very healthy. They've been screened and gone through the process, and they've never experienced something like that. Most of them haven't had surgery before, don't take any medications. I mean, it's a whole new process, and it's a painful surgery. It's tougher on the donor than it is the recipient for the first couple of days. So yes, it is, and then the ultimate responsibility relies on me to just don't mess it up, Kumer.
Don't screw it up. Don't do it.
It's it's an awesome responsibility and a great honor. But I get the chest pain and I lose the hair, and that's okay. So
it all comes out on you. This is what years of taking kidneys out of people does to you. But what's cool though is that the recipient feels better almost within hours after receiving a new kidney, correct?
Yes, they do, and particularly on the living donor side, the mood in the room is different. That the donor and recipient know what's ahead of them. They've scheduled the surgery. There's a certain anticipation that comes with that. So the excitement is mutual in a way that can be enjoyed, and almost invariably these kidneys from living donors work right away. As you saw, Stephanie is climbing Mount Kilimanjaro after donation. She was healthy going in, and she's healthy coming out. So I think that someone that can receive that kind of a kidney donor is going to do well right away, and that's really why we advocate for living donors, is because we have a much better way of predicting outcomes and identifying any hurdles to transplantation.
So the power of social media can be good, it can be bad. In this case, it's good when you can reach out to old friends and somebody's willing to step up. What do you both think? Not saying that you're old, but back in the day when you first started, I don't think people were finding kidneys on Facebook, were they?
No, not so much. I'm trying to think when Facebook came around. I think that my medical career started before Facebook, I hate to say, but that's all right. No, you're right. I think there's a power of social media, and sometimes it's for bad, and these are the types of things that's for good and really should be promoted.
Would you counsel people, or when they say, well, how do I go about finding my own kidney donor? Is that a conversation that comes up?
It does. There are different avenues of looking for donors. The National Kidney Foundation does put on a program to identify donors for this reason.
Okay. On the flip side of that, social media can be negative. So last month, everybody was angry. Certain people were angry, thinking that medical providers were denying a man a life-saving kidney because he would not get the COVID vaccine. Having people meet certain criteria and being vaccinated, this is nothing new. Please explain why we are not dangling life-saving organs over people's head just to get them the COVID vaccine.
Those are difficult choices. Here at our transplant center, we require a COVID vaccine before proceeding to transplant, and that's based in some of the data we've looked at just in our own center with folks that get COVID after transplantation because they're immunosuppressed. They have a higher rate of death and mortality than the general population and vaccinated transplant population. We also have some difficulties with, when you're immunosuppressed, so you're getting the COVID vaccine after transplant, for instance, you don't respond as well to the vaccine. So you wind up having potentially a subpar response. You might have frequent vaccinations after that. So it really comes down to, when we are looking at a process of evaluating a recipient, it's, are you a good shepherd of the organ? We want to save your life, absolutely. But are you compliant? Are you taking your medications before a transplant? We look at your track record. And part of this is, as you mentioned, a long list of vaccines that are required already that people already have, but social media might have changed people's views on the vaccine. So we view it as a life-saving operation and a steward of the organ. And
I love that. Are you a good shepherd of the organ? I like putting it in those terms. It's not a free-for-all. Somebody who receives a lung transplant, they're not advised to continue smoking, correct?
Correct.
So we do advise them through that. This is it's a responsibility to receive organs. They don't grow on trees, so you have to take care of them, and there's lots of people waiting on that list.
True, and it's a trade-off. After transplant, patients are relied upon heavily to take their medicine routinely, to call us when there are problems, and when people get sick, no matter the illness, if they're struggling to hydrate, take their pills, etc., COVID has been the prevalent issue lately. That vaccine helps people get through the process faster, recover quicker, and have less severe illness. So there are a lot of reasons why we push that vaccine, among others, to keep these individuals safe after transplant.
All right, we've got some good viewer questions coming in. They're asking questions I had too, so let's just get to it. My question was about just the mental state. We help people. It's not just physically. We want to make sure that they're emotionally and mentally ready for something like that. What kind of counseling, Joellen wants to know, do donors and their family members receive counseling before and after donation? What is that process like?
They do. There is education essentially every time people come to our health system through the transplant center. They're receiving education. They are given education before they even see us as they're going through the referral process. And then every time they see us, that education is reiterated. And that really comes on all avenues. That is learning about the transplant process, about the medicines, about some of the mental health aspects of disease, that depression and other considerations are common in folks with kidney disease.
Sharon wants to know, kidney disease must be very common. I've seen 7 or 8 dialysis centers here. She's in Corpus Christi, which is actually smaller than the KC area. I'm guessing that hypertension and diabetes cause a lot of kidney problems. Are there measures that we can avoid to stay away from kidney disease?
Yeah, this is part of the initiative for World Kidney Day, is to discuss some of those common medical conditions that can lead to kidney disease down the road. So high blood pressure, diabetes account for roughly half of those that have end-stage kidney disease. And as such, there are things that we don't cure with transplant. We continue to manage those issues afterward. So for those that are trying to avoid seeing folks like us, we do advocate for continued touches with the healthcare provider to make sure high blood pressure is managed, diabetes is managed, and people focus on steps, diet, etc., to maintain their health as best they can.
Anything in our diets that we should add or eliminate to help us with our kidney health?
Drink more water, eat less salt. Don't add any salt to your food in general.
Really? Okay. I'll have to tell my dad. He salts everything. What's your advice?
I mean, I think obesity certainly doesn't help hypertension, diabetes, and so forth. So having a healthy diet, exercise is very important. Our obesity rates have skyrocketed in this country, and that's directly related to our diet and some of our vices. So that's the best thing to avoid those as well.
Okay, question from Pamela. Have you seen many COVID patients end up with kidney problems? She's a long hauler, recently been diagnosed with chronic kidney disease, mild stage 2. I've been told this is reversible. True?
True, unfortunately, that when people get really sick with any illness, then it isn't just the lungs in a case like coronavirus where people get sick. Other organs have effects. So we see people develop heart injury, kidney injury, liver injury in the setting of coronavirus illness. And that's part of why we have tried so hard to get our individuals vaccinated prior to transplant, is to get them through the course faster. We absolutely see kidney injury when people get admitted with coronavirus, and some have severe kidney injury and actually have required dialysis.
Okay, this is a very interesting question. I have not heard of this. Isaac says, a question for our guests. My deodorant has the following message on the label. Ask a doctor before use if you have kidney disease. What's up with that? Have you heard of this? I've never heard of this.
Yeah, it has to do with some of the metals that are used in some of the preservatives to keep sweat off the skin, essentially.
So the armpits?
Yeah.
Too close for comfort? What?
Don't ingest your deodorant and you'll probably be okay.
So don't eat it. Okay. Hold on. Let me write that down. I'm going to take notes. This is why I have you guys on. You guys really help me out. I appreciate it.
I say that ingest, but it is deodorant is topical.
Okay,
and
so
there shouldn't be much
deodorant.
absorption into the skin.
Okay. Couple more things. quickly, because I have to ask Jean's question for Dr. Hawkinson, your thoughts on a new study that shows Omicron BA2 may lead to 27 times increase in vaccine breakthroughs. Have you heard about this?
No, I mean, I think in general that is the issue that we have seen with Omicron because the spike is so different. For most people, without that boost or that additional dose, we know that there was a lot of antibody evasion. Again, I think this is referring to actual infection, which for the most part, we are concerned with cases, but we aren't concerned as much with cases as we are with hospitalization. So I think in the context of this, it sounds like this is more dealing with infection. So just a case, but what we really want is protection from hospitalization, severe disease, and death. And we know that these vaccines, even with Omicron, and from what I understand with BA2, have continued to provide that protection against hospitalization, severe disease, and death if you are up to date, meaning if you have that third dose, or if you are immunosuppressed, if you've had that fourth dose as well. So I think that's it, and that's one of the problems that we understood was that there was a lot of antibody evasion, our immune system evasion as far as antibodies, so there were more cases going on even though people had Delta or had Alpha, they had been vaccinated. It was just those cases, and that is the reason why. But for the most part, again, the vaccines have continued to show very good protection against hospitalization, severe disease, and death if you are up to date with those, even for Omicron.
All right, before we wrap up today, I do have to ask you both, because we started the show talking about the gentleman who passed away after 2 months of receiving the pig heart transplant. Tell people a little bit about what that entails. Help us understand that. Is this cutting edge research? Is this someone who is not does not qualify for any other type of heart?
Yeah, that's a tough one. I don't have entirely a lot of depth in this conversation, but nonetheless, Dr. Bartley Griffith is the surgeon that performed this and did a lot of the research. He's a brilliant man. I have actually had the honor of operating with him when he used to be at University of Pittsburgh. He's a really intelligent person, cutting edge. It is research that this recipient did not otherwise qualify for a human donated organ. So this was research. It was an attempt. It was genetically modified pig that they placed in this recipient, and unfortunately, a lot of these things. When we look at sort of the history of transplantation, we had folks that had liver transplants, heart transplants, kidney transplants in the past that didn't live long lives. They were it was experimental at that time, and they really pushed our science to where we are now. So this might be the next step. We'll have to see.
Yeah, Dr. Klein, I mean, there's ethical issues that go into all these kind of conversations, but just what can you add to that conversation in closing?
Well, we continue to find ways to identify new sources of donors that, given the scarcity, as we've talked about, living donors, deceased donors, there still aren't enough to go around to help all those in need. And as such, we continue to find ways to push the envelope and pioneer.
All right. Not doing that here, though.
No plans for that at this point.
Okay.
But yeah,
that happens. I'm getting you back on.
Yeah.
Okay. Yeah. That's a whole show.
I might run and hide. I don't know.
Okay. All right. Well, let's just get quick final thoughts from you guys. I know you both have busy days, so thanks for being with us. Dr. Klein, just final thoughts on this World Kidney Day.
I'm honored to be here to talk about kidneys on World Kidney Day, and for anyone that's interested in living donation, please consider contacting your local transplant center. And for those of you that cannot donate from a living donation side, consider signing your donor card.
Dr. Kumer, final thoughts.
Yeah, I think I echo Dr. Klein's thoughts. Share your spare. When you're thinking about this, the first step is just a call, and it doesn't have to go further than that. So give a call. You can certainly look online, but give a transplant center a call and get some education and see the process and what it entails. And then you decide, is this for you or not? And we'll certainly shepherd you through this process the best we can.
I think that's great. In some of the stories I've done with you both, I had a woman, I always ask that question. There's so many other things you can do. And they're like, well, I don't have a lot of time. I don't have the money, but I did have an extra kidney. And you know, everybody gives in their own way, and it's really remarkable. So we're happy to highlight those folks today, and we appreciate you so much. Dr. Hawkinson, anything else you'd like to add?
Yeah, a couple things. I think it was mentioned before, but we'll bring that up again. You know, the vaccines prior to transplant, whether it's solid organ or bone marrow transplant, or any really immunosuppression, the vaccines have been part of our protocol for a long time. And those vaccines even include things to protect you against diseases that don't carry as much as risk as COVID. But we know they're safe, and we know that if you get those diseases and you are immunosuppressed, you have higher chances of hospitalization and death. And so the vaccines are safe and are recommended, and it is part of the protocol to help protect you once you do get immune suppressed. And again, our numbers are down for active infections, and so I got some information. The last time we had active infections in the teens was July 1st, 2021. So we're a little bit further out from that now. But luckily now we are in the teens with our current active infections. And then for our total just being in the teens, that was in March of 2021. So again, all of our numbers are continuing to decrease. That's a good thing. And I think I'll be remiss if I, again, didn't emphasize, please go get vaccinated, go get up to date with your vaccinations.
All right, Doc Hawk, thanks so much. Okay, everyone, break out the shovels. We're going to take a live look at EarthCam, downtown Kansas City. I will be doing no shoveling today, I'll just say that. Cardiologists here at the health system, though, say that the cold and added to the lack of activity, that places an extra demand on the human heart, leading to heart attack in some cases. Among the early warning signs of overtaxing your heart are dizziness and extreme fatigue. Dr. Brian Wyford is a cardiologist here at the health system. Here's what he said.
I think if they feel the need to go out and shovel their driveway, number one, they need to make sure that they're adequately dressed and prepared for the cold. And number two, take it slow. Listen to your body. If you're having shortness of breath, if you're having any chest discomfort whatsoever, it's time to stop and get indoors.
He also adds that shoveling, even pushing a heavy snowblower, can cause sudden increase in blood pressure and heart rate. Then you combine that with the cold air, can cause constriction of the blood vessels and decrease oxygen to the heart. That is why I never shovel. Never do it. Don't do it. Okay. Our newest. See, these are all lessons I learned when I work here. Okay. Just
I
stay
like
inside.
how you think. That's a good way to phrase it, Jess. I'm going to get out of shoveling too.
That's why you have kids.
That's why you. Exactly. This is what we have kids. You've got a teenager, Alexis. That's what he should be home doing today.
That's true. That's true.
It's very true. Okay. So speaking of heart, all things heart, it's coming your way here in just about an hour or so. Host Alexis Del Cid, of course, is joining us today. Good to see you, friend. Give us a few headlines, a few heart headlines, and tell us what's coming up this morning.
We have a great show coming up this morning, and we also have some really interesting heart headlines to tell you about. So taking a look at your heart headlines for this Thursday morning, listen to this one. People who get COVID face a higher risk of 20 different heart and vascular diseases. 20. The study's published in the Nature Medicine, and it shows the disorders include everything from heart failure, stroke, blood clots, and heart inflammation disorders. Researchers believe COVID attacks the heart muscles during the infection, which leads to the inflammation. And now, Jess, I know you don't like doing your chores. No one does, right? This might change the way you look at those annoying household chores, though. A new study out of the University of California, San Diego, finds that those chores can reduce your risk of having a stroke or developing heart disease. Researchers say if you do 4 hours of housework a week, including vacuuming, dishes, you can reduce your risk by as much as 43%. Maybe we can tell our husbands that. They'll start doing more chores. And as you drive around the metro, keep your eyes peeled for some gorgeous heart work. More than 150 giant hearts decorated by artists across the area are on display. This is called the Parade of Hearts. Some of those artists are also employees and healthcare providers here at the University of Kansas Health System. So we shot some video of the hearts being installed outside the hospital here in KCK. The Parade of Hearts features tributes of so many levels, from the Jazz District, love of barbecue, healthcare workers on the front lines of the pandemic, just to name a few themes. Jen Nesbeck works with Hope House, and she's co-chair of the Parade of Hearts.
Having 14 sponsored hearts throughout the region, and really kind of leading in the sense of, you guys have such a will and a heart forward. Your healthcare workers are our heroes, and there is a heart that really represents that superhero. And from the bottom of our hearts, thank you for supporting and being a part of this endeavor.
The Parade of Hearts runs for the next few months, and if you want to check out all the hearts around the city, that would be a really fun way to spend a couple of hours. Organizers have launched an app. You download it. It includes incentives for certain locations that you visit, and these hearts then are going to all be auctioned off in June, and some of that money will go to support the cardiothoracic programs here at the health system. And speaking of cardio, we do have a fantastic show coming up at 10 a.m. on All Things Heart. This one is about drinking and your heart. Whether it's a single glass of wine or a beer or a night of heavy drinking, there's a very real condition that doctors are talking about. It's called holiday heart. And as we approach St. Paddy's Day next week and spring break, we're really getting into the season of indulging. So we're going to talk about holiday heart, how to avoid it, how to know if you have it. And we're also going to let you know some really good resources here that you can use, or if you or someone you know is struggling with addiction. That's all coming up at 10 a.m. on All Things Heart.
Oh, that's good stuff. I love those hearts. I can't wait to start seeing those all over town.
They're really pretty. Yeah.
Very cool. Very cool. Thanks for the update. We'll see you here in just a bit. We'll be watching. Okay, March 30th is National Doctors Day. It honors doctors for their dedication and contributions to society and the community, and they have been working hard. Here at the Medical News Network, we're giving you a chance to thank a healthcare worker. You can click right there on that QR code. It's going to take you to your email where you can send or record a special message. And then we're going to play those right here on Morning Medical Update. I know a lot of you send in comments saying, how do we just tell people how much we appreciate them? And so we're going to give you that opportunity to do that. And then we're going to share your words of kindness to our healthcare community. And we appreciate that very much. And we just thank you for being with us today. Don't forget, you can catch our show anytime by joining us on Facebook, YouTube, and now on Twitter. The Big 12 tournament is underway, and we have heard for years that March Madness is the time of year many men like to take off because 'tis the season for basketball and vasectomies. Plus, how do the players and the rest of us stay safe as we enter this new normal? We'll talk all about that coming up. See you at 8.